Good evening, everyone. I'm Dr. Aditya, Faculty of Oral Radiology in AIIMS, Delhi, and today we are here to recall all the questions that came in the November 2025 Oral Radiology section. I heard it was quite a good paper. Okay, so before starting, what was this oral radiology paper all about? Okay, so first thing that I saw, that there were questions on syndromes. Okay, then there were questions on advanced imaging like CBCT, visual questions. Then there were questions on cyst and tumors. Basically, how will you decode basically the examiner wanted to know how you will reach towards a diagnosis. So basically the questions were a mix of path, oral path and radiology. Okay, so all in all, I think quite good paper, and most of the things were from notes. And I would love to know, all the dance students, I would love to know, how did you find the radiology paper? Because most of the questions we had discussed, almost, not most, I think all the questions were discussed in the classroom. Okay, so without wasting any time, we are going to move to the recall questions, and let's see how many of you got it correct. So let's start. So the first question, now see, these questions were recalled by many students. Okay, so there might be some discrepancies that you think what the question was. So I am just giving you a gist of what I heard from the recall. Okay, because I was not giving the exam. So if there are any discrepancies, you can definitely tell me. Okay, so a 63-year-old male shows pain and swelling in the jaws. So the first thing the examiner is telling you that it is the 6th decade of life. The gender is male. He is having pain and swelling in jaws. Okay, X-ray shows multiple punched out lesion multiple punched out lesions in the jaws. देखो भाई, ये जो टर्म है ना, ये पूरे आंसर को बता रहा है. Then multiple lesions in the long bones and skull also. ठीक है, अब इससे ज्यादा आपको थाली पे परोस कर नहीं दिया जा सकता. अब जो तीसरा है उसके बाद तो उन्होंने बस बोल ही दिया कि भाई अब तो कुछ कीजिए, अब तो आप सही आंसर लगा दीजिए. सो तीसरा उन्होंने दे दिया बेंस जोन्स प्रोटीन in the diagnosis. Okay, so the first option is multiple myeloma, liposarcoma, fibrosarcoma, Ewing's sarcoma. Okay, so I hope most of you, I hope all of you have put the correct answer, which is multiple myeloma. Multiple punched out lesions in the jaws or multiple punched out radiolucencies in the jaws, long bones and skull with Benz-Jones protein diagnosis. So multiple punched out radiolucencies can be seen here. This is a skull radiograph. Even in the jaws and in the long bones, there will be multiple punched out radiolucencies that will be seen with increase. The lab finding will be the increase in Benz-Jones protein. Okay, next. A 12-year-old, he's in the second decade of life, presented with multiple radiolucencies. क्या है? Multiple radiolucencies, bifid ribs, palmar plantar pitting, and calcification of Fox cerebri. This was discussed in the class when I was discussing cysts and tumors, and this cyst or this question is associated with a very important tumor, very important cyst or a tumor, which is your OKC or your KCOT. Okay, कौन सा होता है आपका सिंड्रोम जो आपके ओकेसी और केसीओटी के साथ रिलेटेड होता है? मल्टीपल रेडियोल्यूसेंसीज, बाइफिड रिब्स, बार्मर प्लांटिंग पिटिंग एंड कैल्सिफिकेशन ऑफ फॉक्स सेरिब्राई. योर ऑप्शंस आर एपर्ट्स सिंड्रोम, एस्चर सिंड्रोम, प्यूट्स-जुगर सिंड्रोम, nevoid basal cell carcinoma syndrome, or also known as Gollen-Gault's syndrome. So Gollen-Gault syndrome or your nevoid basal cell carcinoma syndrome is associated with OKC or KCOT, which in here is your multiple radiolucencies associated with bifid ribs, palmar plantar pitting, and calcification of Fox cerebri. Okay, so Gollen-Gault syndrome, also known as nevoid basal cell carcinoma syndrome, specific radiological findings including OKCs or KCOT and calcification of the Fox cerebri, which are very crucial for diagnosis and management. Okay, clear? So your answer is correct. Now there was a visual question or image based question. Radiographic image shows which of the following? So I have just taken this radiograph based on what the students told me, that there was in the posterior mandible there was a radio opacity surrounded by well defined or a thin rim, a homogeneous radio opacity surrounded by thin rim of radiolucency. Okay, so now we need to know what answer best suits with this image. This is the image. Okay, so if you see this area, well defined radio opacity surrounded by a thin rim of radiolucency. तो पहली चीज, अब maybe the age was given, maybe the gender was given कि कहां पर हो रहा है. पेन था पेशेंट को, नहीं था, बिकॉज ऐसी सिचुएशन में और जो ऑप्शंस दिए हैं उसमें पेन प्लेज अ वेरी इंपॉर्टेंट रोल. ओके, सो ए ऑस्टियोइड ऑस्टियोमा, बी ऑसिफाइंग फाइब्रोमा, सी ऑस्टियोमाइलाइटिस, डी ऑस्टियोसार्कोमा. नाउ your osteosarcoma basically doesn't have this kind of appearance. It will either have a Codman's triangle, which is a periosteal reaction, or the other periosteal reaction is sunburst appearance. Okay, so osteosarcoma comes in two visual forms in the X-ray, the Codman's triangle and the sunburst appearance. So neither of that can be seen here, so option D is incorrect. Then come osteomyelitis. Osteomyelitis, there will be formation of sequestrum and involucrum. Sequestrum is the dead bone and involucrum is the new live bone, and the area is not well defined. It is irregular. Okay. So again, osteomyelitis may not be the correct answer. Now we are remaining options are osteoid osteoma, which is very uncommon in jaws. Ossifying fibroma is common in jaws than osteoid osteoma. Okay. So if you see, this is a case of osteoid osteoma where you can see a radio opacity surrounded by radiolucency, and the same you will see here, radio opacity surrounded by radiolucency, and both tend to be in a place where there is edentulous area, and in the section also you can see that there is no tooth. But just based on the prevalence, I would go with option B rather than option A. So ossifying fibroma is more commonly seen in the jaws, especially cemento ossifying fibroma, which is more common than juvenile ossifying fibroma. Okay, so cemento ossifying fibroma presents with this kind of scenario. Okay, so for me, ossifying fibroma will be more apt than osteoid osteoma. Okay, next. Interproximal caries in primary molar is best seen in, I think this is a very easy question. Panoramic view में हम normal caries नहीं देखते, interproximal caries तो बिल्कुल नहीं देखेंगे. Periapical view में भी हम interproximal caries, yes, you can judge, but not taken in a theoretically correct way. Bite wing view is the view in which we would like to do the diagnosis for interproximal caries. So my answer will be C, bite wing view. Next, identify the type of radiograph. So there are two radiographs. This is ray sum image. Again, we have discussed this radiograph, ray sum image, in which all the areas are given with anatomic superimpositions. These are transaxial views and custom slicings. Sorry, these are, I think, oblique slicings. Okay, so what is the type of radiograph that is being given? The first option is OPG. This doesn't look like an OPG. Occlusal view, भाइयों और बहनों, आपको occlusal view लग रहा है क्या ये? Is this a CBCT panoramic view? Yes, this is a CBCT panoramic view in which you can see all the areas which is known as ray sum. Ray sum is basically all the voxels are present and all the data is present, and then from that data we can scroll up and down and we can see whether this area can be seen or not. So this is how So this is how you diagnose. So I would like to show you how actually it looks like. What I'm trying to tell you, that this is the CBCT panoramic view in which you can see everything. Okay. So by the time it loads, let's continue. So the correct option for this will be your option C, that is, it is a CBCT panoramic view. Next comes, what is the exposure in microsieverts for lateral ceph? Again, a question that we continuously revise year end. Okay, so what exposure in microsieverts is for lateral ceph? So lateral ceph का जो microsieverts में हर किताब में दिया गया है, that is around 3 to 6 microsieverts. So option A is not correct. Option B, less than 10, is correct. 20 is not correct. 30 is not correct. So 3 to 6 microsieverts is the correct answer. So अपने लिए less than 10 will be the answer of choice. Next comes okay, so this here. So basically here is the total area जो हम अभी पढ़ रहे थे. अगर आप यहां पर देखेंगे, अगर आप ऐसे देखेंगे इसको, ये आप देख रहे हैं दांतों की एक एक स्लाइस और ये पूरी इमेज रहती है. सो बेसिकली इफ यू गो फ्रॉम हियर, यू कैन सी, अब ये एक ही सेक्शन था तो ये पूरा एरिया हमको ये दिखने लगा है, प्लस ये एक इस तरीके से दिखने लगा है. तो दिस इज बेसिकली एन ओपीजी का एक पार्ट हमने ले लिया है. ओके, okay, so next, which of the following is a clinical feature of nasopalatine cyst? Okay, it is the most common non-odontogenic developmental cyst. Okay, non-odontogenic, most common odontogenic dentigerous cyst. So which of the following is a clinical feature of nasopalatine cyst? हमसे clinical feature पूछा गया. तो anterior palatal swelling, bluish discoloration of incisive papilla, discoloration of maxillary anteriors, salty taste in the mouth. Okay, so nasopalatine cyst में basically this is the radiological feature of it, causes bodily displacement of teeth. Okay, it causes bodily displacement of teeth, first thing. Then teeth are vital in nature. Very important, teeth are vital in nature. Anterior palate पे there will be swelling and slight bluish tinge. Okay, there will be slight bluish tinge that will be there. Okay, this radiolucency becomes, as the long standing it becomes heart shaped radiolucency. Okay, so which of the following is a clinical feature of nasopalatine cyst? Anterior palatal swelling, correct. Bluish discoloration of incisive papilla, correct. Discoloration of maxillary anteriors, false, not correct, because it remains vital. It is not non-vital. Salty taste in mouth, no. Most commonly these two, 3 and 4, what is happening? 3 and 4 are seen in radicular cyst. Okay, so 1 and 2, option A, 1 and 2. For me, this is the correct answer. Okay. Next, a patient presents with swelling in maxilla. The first hint, swelling in maxilla. X-ray reveals unilocular radiolucency. दूसरा hint, unilocular radiolucency around an impacted tooth. So what they have not mentioned, whether this swelling in maxilla is in the anterior portion or the posterior portion. Or they might have mentioned, students did it not convey. Histology reveals odontogenic epithelium in duct-like structures along with eosinophilic matrix. ये सबसे important है, eosinophilic matrix. Look, I am not the final authority on the oral path, but based on both the things, swelling in maxilla, unilocular radiolucency around an impacted tooth, eosinophilic matrix, इन तीनों को अगर हम मिलाते हैं तो पहला ऑप्शन आता है आपका CEOT, दैट इज कैल्सिफाइंग एपिथेलियल ओडोंटोजेनिक ट्यूमर और योर पिंडबॉर्ग ट्यूमर. पहली बात, पिंडबॉर्ग ट्यूमर मोस्ट कॉमन इन मैंडिबल. यूनिलॉक्यूलर रेडियोल्यूसेंसी विद ड्रिवन स्नो अपीयरेंस, रेडियो ओपेसिटी रहती है अराउंड एन इंपैक्टेड टूथ. ओके, कैन बी सीन, बट रेस्ट डज नॉट गो वेल, नॉट करेक्ट. डेंटिजरस सिस्ट, मैक्सिला अनकॉमन. बाकी चीजें हो सकती हैं, ईस्नोफिलिक मैट्रिक्स नॉट कॉमन. एमिलोब्लास्टिक फाइब्रोमा, अगेन पेशेंट की एज नहीं दी गई है हमें. फाइब्रोमा मोस्टली कॉमन इन बच्चे. ओके, तो AOT, that is your adenomatoid odontogenic tumor. Swelling in maxilla, correct. Unilocular radiolucency, correct. Impacted tooth, correct. Eosinophilic matrix होता है, most common in anterior maxilla. So for me, this option D is the correct answer. This is how a unilocular radiolucency associated with an impacted tooth, a unilocular radiolucency associated with impacted tooth is hallmark of adenomatoid odontogenic tumor. Okay, clear? ठीक है. Next, I think that's it. So I hope most of you got the answers right, and I hope कि जो हमने पढ़ाया, everything was there. Okay, so I wish you all the best for your future exams and for the outcome of this exam. Another faculties are going to take the other parts, so please do attend all those sessions. Thank you so much, and good night, and have a